Dr. Trevor Miller here, and I want to take a few minutes just to talk to you about soda and how this is literally killing you slowly in multiple ways. So first, let's talk about a soda, and it doesn't matter what sodas. There's two major components to all sodas. One is the carbonation, and the second is the sugar, not to mention all the other chemicals. But let's just keep this simple and let's talk about the carbonation first. So that carbonation, when you drink that carbonation, that goes into the gut and then through the chemical processes is slowly turned into carbolic acid. And as this happens, your body has enough what is called buffering capacity. So if you have a 12-inch can of soda, normal soda, and you drink it, it has enough, your body has enough buffering capacity in the bloodstream to buffer out 8 of that 12 ounces. Where do you think it gets the other 4 ounces of buffering capacity? And this is a very simplistic speak. There's a lot more to it, but I just want to keep it easy for people to understand. So you still have this remnant of 4 ounces roughly that is in your body, and your body has to get out of it, has to get it out. pH is very important. pH balance inside the body is very important. Where do you think your body gets the calcium, magnesium, and phosphorus that it needs to buffer out this acid? Well, you're exactly right. It gets the calcium and phosphorus and magnesium and all of those minerals from teeth and bones. And so if you're drinking a lot of soda, you are demineralizing your bones and your teeth. And we see that because what happens to people who are heavy consumers of sodas? They lose their teeth. They tend to break bones more easily, especially as they get older. And now let's talk about the second component of soda, the sugar called fructose. Fructose is a signaling sugar to the body, and it tells the body, hey, winter is coming, we need to pack on weight. And so it takes in the body, it doesn't stimulate insulin, but it takes the regulatory valve off of the insulin process. So once stimulated, the insulin pretty much runs free. Once again, an oversimplification, but it should make the point. And that's one way that that's a problem, because now insulin is allowed to last a lot longer in the body. And when this is happening, what happens to you is your body actually has enough glucose in the blood vessels or in the circulatory system to last about 45 minutes. Once insulin is stimulated, it lasts about 3 hours. So what happens to people who eat simple carbs, who drink sodas? They get the caffeine buzz, and then slowly over time, they get really tired and they have to consume that again. So what ends up happening is it causes a roller coaster of energy. Now, that is one way that fructose kind of gets in the body and creates some havoc. The next thing that it does is fructose goes through the liver exactly like alcohol. It comes out the other side as an acetaldehyde. It doesn't affect the brain so much, but it does affect the liver exactly the way that alcohol does. I am not going to get into that biochemistry. If you watch, it should be attached to this video, if you watch Sugar the Bitter Truth by Dr. Lustig, he will go through that biochemistry for you. If you have insomnia, he'll help cure it. But that's the other way that fructose affects the body. And that's not just in sodas. When we are drinking fruit drinks, that's fructose. And so that also causes fatty liver. It also causes what is called non-alcoholic fatty liver disease. That's what we see in children that consume high amounts of fruit juice and sodas. You should not consume it. Just point blank. There's nothing redeemable about soda. So if you want to know more, watch Sugar the Bitter Truth below. Otherwise, we'll see you next time. Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.